Most people believe contraceptive devices simply block pregnancy, as if they are passive barriers, doing nothing more than standing in the way. But the Copper IUD does something far more intelligent. It reprograms the uterine environment itself, turning it into a hostile biochemical battlefield where sperm lose motility, energy, and viability long before fertilization can even occur. This is not memorization, this is mechanism. And once you understand it, you will never explain the Copper IUD the same way again. The Copper intrauterine device is one of the most effective long-acting reversible contraceptives used worldwide. Its failure rate is less than 1%, yet it contains no hormones and requires no daily compliance. So the real question is not if it works, but how it works so powerfully without hormones. The answer lies in local biochemistry and immunology, not mechanical obstruction. The device releases copper ions continuously into the uterine cavity. And copper is not biologically neutral. It is toxic, selectively toxic, to sperm cells. To truly understand this mechanism, let's walk through the same questions that students and clinicians usually ask in a guided clinical discussion. Copper ions released from the IUD alter the uterine environment at multiple levels.
So it doesn't just prevent implantation?
Correct. That is a common misconception. The primary effect occurs much earlier, at the level of sperm physiology. Copper interferes with sperm motility by disrupting membrane integrity and inhibiting mitochondrial enzymes required for ATP production. Without energy, sperm cannot swim effectively.
So fertilization becomes unlikely?
Exactly. But the effect doesn't stop there. Copper also induces a local inflammatory response inside the endometrium. Leukocytes increase, prostaglandins rise, cytokines are released. This creates an environment that is chemically hostile to both sperm and ova.
Is this inflammation harmful?
It is controlled and localized. It is harmful to sperm, but not systemically harmful to the woman. And this same inflammation explains many of the clinical effects patients experience. Now the mechanism begins to explain the side effects. Why does menstrual bleeding increase in some women? Because copper increases prostaglandin synthesis, leading to vasodilation and increased endometrial shedding. Why do some women experience cramping? Because the inflammatory response increases uterine contractility. And what about infection? Importantly, the Copper IUD does not cause chronic infection. The risk is related to insertion technique, not long-term presence. Once inserted properly, the uterus actually maintains a protective immune state. This is why understanding mechanism prevents unnecessary fear. From a public health perspective, the Copper IUD is one of the most powerful tools available. It provides 10 to 12 years of contraception. It is immediately reversible. Fertility returns as soon as it is removed. It can be safely inserted postpartum. It does not interfere with lactation, and it avoids systemic hormonal side effects entirely. One of the most persistent myths is that it causes infertility. This is false. There is no evidence that copper IUDs cause long-term infertility when inserted under proper conditions. Mechanism matters, because myths survive where mechanisms are not taught. The Copper IUD is not passive contraception. It is an active biochemical defense system, disrupting sperm metabolism, altering immune signaling, and reshaping the uterine environment before fertilization can ever begin. When medicine is taught as mechanisms, it stops being confusing and starts making sense. This is Clinomechra.